this lesson, I'm going to explain mastitis and what you're going to do for this patient. All right, let's get a few basics out of the way on mastitis. So mastitis is a bacterial infection, and it's most commonly occurs in breastfeeding mothers. So it's associated with breastfeeding. And then it most commonly is going to occur a few weeks after delivery. So what is this patient going to look like? What are her assessment pieces? So she's going to have flu-like symptoms because it is a bacterial infection. So that'll be aches, you'll have chills, she'll be febrile, the high temperature. And she's also, in addition to that, going to have some pain and tenderness occur at the site. She might have some localized edema, and she'll also have some redness that's going to occur. And it's just going to be localized at that site. We are never really seeing our patients get mastitis because it happens after they're home. Remember that few weeks after they deliver. I did have it with both of my kids, so I can tell you it comes on so suddenly. I remember feeling achy and so tired, couldn't really figure out what was wrong because, my throat didn't hurt, no stuffiness, anything like that. And then suddenly had a temperature of 102. And I did have a super tender spot, red area. And so off I went to get some antibiotics. So this image that you see here is a very severe case. So this is not 100%. This is a person that didn't get treated. So what you will see, this is a patient that has an abscess, which we'll talk about, but usually you'll have redness like this localized to an area where the clogged duct is, okay? And it gets red. Now, if it goes untreated or in very severe cases, and very rarely, the patient can get an abscess that forms at that site where it will have to be drained and removed. So this patient looks like she's got an abscess all the way around and the nipple is having some of that abscess and pus come. So for your patient, patient comes in the doctor's office, it's going to be a localized red area like this, but you can see how angry and tender that looks, and that'll be localized to that spot. So our therapeutic management, what are we going to do? How are we going to treat this patient? She must continue feeding, okay? You have to, and you're going to be asked that over and over on test questions. Continue feeding. Breastfeeding is going to be the best, but she also can pump. And the reason why breastfeeding is best is because it's just natural. So it's going to empty the breast better. But whatever she does, whatever she chooses, she just has to keep the milk moving. We don't want it to sit there and be stagnant. It'll just cause, she's more likely to get an abscess, and then it's just going to block up more. So we want to help that by continuing feeding. Now, if she does get an abscess, it sometimes can be contraindicated by physicians depending on how the abscess is. The abscess needs to be drained, so they might advise that mother not to breastfeed or pump during that time, but she can hand express just to help relieve that pressure, keep the milk moving. She is going to use warm compresses, and that's going to help to just with the inflammation, the pain, but also just to help dilate those ducts and get the milk moving as well. So it's nice to use those warm compresses during feeding too, just to help. Antibiotics. So this is a must, right? Because it's a bacterial infection. So she's got to take her antibiotics and however they're prescribed for her. And then also some pain medications. So ibuprofen, things like that, just to help with that discomfort. And you're just going to need to make sure you educate on all these things. So continue feeding, the warm compresses, antibiotics, and pain medicine. When or if she has an abscess, because of the pus, it can make the milk taste kind of funny for the baby. So they might not want to give that milk that is pumped to the baby or hand expressed to the baby, but they can continue to feed on that other side that is not affected. Our concepts for this patient are infection control because the mom's infected, comfort because it hurts and we want to help her feel better and resolve the mastitis, and then nutrition because this is the baby's food source and the mom needs to continue breastfeeding. Okay, so what have we learned? Mastitis is a bacterial infection. It's going to come on suddenly. We're going to have flu-like symptoms occur. So those aches, chills, and the high temperature. She's going to have painful red spot localized to that breast, to that area. And she needs to keep feeding, right? We got to keep the milk moving. So she can pump or breastfeed. And then antibiotics is how we're going to treat this. Make sure you check out the resources attached to this lesson, review symptoms and your management. Now go out and be your best selves today. And as always, happy nursing.